Hi, I am Dr. Mayuri Pandya and I am instructor and program director at AIMS College of Health Science for EKG and phlebotomy program. So today I am demonstrating you how we teach our students on the mannequin arm. Now my student Yuchena is performing on the mannequin. So she will follow all the steps and I am just telling you the steps. So first you tie the tourniquet to see the vein, which vein is good. So after tying tourniquet, we palpate the good vein. So she selected the vein and that the name of that vein is basilic vein. Okay, very good. You clean with the alcohol swab and we allow alcohol to dry at least for 30 seconds, and meanwhile she is assembling all the equipment. So there is a second time application of tourniquet, because if we keep tourniquet for more than 1 minute, patient will have problem with sometimes the circulation of the arm. So that's why we release tourniquet and reapply it. And now she is ready to do the procedure, venipuncture. So anchoring the vein downward and now inserting the needle. So it is at 15 to 30 degree angle. And now put the tube inside the hub and she get the blood. We invert the tube so it mix with the additive, and now finally we have to remove the needle from the patient's arm. Immediately cap the needle so there is no needle stick injury, and we ask the patient to apply pressure, and in that time she put the sharp in the sharp container. Now check for stoppage of blood and we confirm like bleeding has been stopped. So now she is putting the band-aid over that. Okay, very good. And now it is the time to give the patient post-procedure instructions, like when they have to call the doctor, what is the report, and also we thank the patient. And finally we ask them, do you have any questions or any concern? So we are here to help you. Okay. Thank you so much.